Hello and welcome to my channel. I'm Dr. Arshia. Today I want to discuss about the drugs called Fluvoxamine. And this drug is a repurposed drug to fight COVID-19. And recently there has been some human trial on it. So I want to have a quick review on what happened there and what is the effect of these drugs on preventing COVID-19. So if you are interested, please follow me to this video. So before I discuss about this human trial, let me explain what is fluvoxamine and how does it work and why they choose it to fight COVID-19. Fluvoxamine belongs to the group of medicine that they call it SSRI, or selective serotonin reuptake inhibitors. They basically used for depression. It's antidepressant drugs. So now that the scientists understand the mechanism of action of the virus and how does it infect the cell, how does it reproduce inside the cell, any type of medicine that can interrupt this cycle can be used to fight COVID-19, including fluvoxamine. Fluvoxamine works in 4 different pathways to fight the COVID-19 infection. One is by reducing the platelet aggregation. It also decreases the mast cell degranulation, and it interferes with the endolysosomal viral trafficking. And finally, it regulates certain enzymes such as 1-alpha, which has a direct effect on the inflammation and also increasing the melatonin production. I will make another video regarding melatonin and its effect on our immune system, so don't forget to subscribe so you won't miss that video. So if you want to discuss in detail what is platelet aggregation, platelet aggregation is about the platelets that are sticking together, causing blood clot, which later can cause organ failure, heart attack, and brain stroke. At the same time, decreasing of the degranulation has a direct relation with the cytokine storm, because once the cell get under attack, they're releasing certain chemical cells and protein, especially cytokines, that it attract the killer cells such as T cell, that they come and destroy those infected cells. But the problem is, in case of a COVID-19 infection, this system get out of hand and this cytokine alarming the T cell to destroy the healthy cell. I already made a video regarding that. I leave the link to that video in the description if you want to watch. The next mechanism is a little bit broad mechanism, which I have to make another video regarding that, but basically working on the endolysosomal viral trafficking. Once the virus hijacks the cell, it uses a certain organelle within the cell for its reproduction and also releasing the virus outside the cell so it can infect other cells. And one of the organelles that is involved is lysosome. So I will explain more about that, but basically these drugs interrupt with this procedure, therefore the virus cannot release outside. And the last one, as I mentioned, is the working with the 1-alpha enzyme, regulating it, so less inflammation, less cytokine. At the same time, it helps the production of the melatonin, which has a direct effect on the immune system. So with these 4 different mechanisms, this medicine is supposed to be able to fight COVID-19. So what is significant about this new human trial? First of all, this trial back in 2020, which they conducted a preliminary test, and in that preliminary human trial, it was very successful. So in October 2021, they decide to do a larger human trial, and the significant part of this is they try fluvoxamine on unvaccinated people. So there is no chance that the vaccination can help or save these people. They were all unvaccinated. The patient that chosen for this trial all have known that have a high risk factor for severe disease progress. All this group was randomly assigned to either getting fluvoxamine 100 milligram every day for 10 days or get the placebo. So the first positive outcome of this study was the proportion of the patient who have to at least hospitalize for 6 hours, and so was much lower in the fluvoxamine group, which were 741 patients in this group, compared to the placebo, which were total of 756. And at the end of the story, I can conclude for you there was only 1 mortality recorded in a group that received fluvoxamine, and there was more than 12 deaths in the placebo group. So this study was very positive. Doctors have submitted the fluvoxamine EUA application to the FDA, and they're waiting for the approval. and it was a positive outcome. But there is a downside to these drugs, because if you have any type of mental health issue and depression, or you have some kind of preconditions such as kidney liver problem or respiratory disease, they're not suggesting you to take this medicine. And another problem with this human trial is they had to take out some of the patient that was participating, whether due to the mental health issue or some precondition, which those taking out the patient and participant can little bit affect the final data analysis. So that is for today. If this video was interesting and informative for you, don't forget to like and subscribe. Till next time.